Our guest today is Dr. Stephen Langley, the Chief of Cardiac Surgery at Driscoll Children's Hospital, the Heart Center Medical Director, and the Harmon and Grace Dobson Distinguished Chair in Pediatric Congenital Heart Surgery. Since coming to Driscoll, he's helped build an incredible heart center, making sure that kids in South Texas get the very best heart care close to home. Let's get into it. Thank you for joining us today, Dr. Langley. We are thrilled to have you as a guest. I know you have a very busy schedule, so thank you for taking time out of that to be here. You joined Driscoll in 2019, and you have been incredibly busy ever since. But take us back. What led you to medicine? Take us back on your journey.
Okay, well, that's a long time ago. I grew up in England in actually a small fishing village in the south of England. I still have family there. My parents, brother and sister live very nearby. And when I was an older teenager, decided that I wanted to become a doctor. And in England, most people go straight from high school to medical school, which is what I did. And so left that little town. And when I was 18 or 19, went to London and studied medicine. And the course in England tends to be 5 years. And so by the time I was 23, 24, I was a doctor doing my early part of my training, internship. We call them they call house jobs in England. It's the same as an internship. And then ongoing into training as a surgeon, first as a general surgeon, then as a cardiac surgeon. So the general surgical training is about 4 years after medical school, 4 or 5. In England, for cardiac surgery, it's 6 years on top of that. And then if you want to do pediatric cardiac surgery, it's another 2 years on top of that. So it's 11 or 12 years after leaving medical school that you are considered to be trained and in a way kind of let loose and to start working independently.
Wow, that is a long time. What was there a moment where you knew cardiology specifically was the area you wanted to go into?
I would say yes. And cardiology and cardiac surgery, they're a bit different. So cardiac surgery involves operating on a patient's heart. Cardiology, I guess, involves every other aspect of the care of the patient's heart except an operation. And so I remember I'd been a doctor for a couple of years. I'd actually never seen any cardiac surgery. And at the time, I was doing a short stint in anesthesia and was on the cardiac arrest team. And one night there was a cardiac arrest in the cardiac intensive care unit. And one of my friends, my medical school friends, was in there involved in the cardiac arrest. And the patient had undergone cardiac surgery that day, a coronary artery bypass graft. And my friend was removing some vein from the patient's leg to do another bypass graft. And he said, "Oh, hey, Steve, hey, how are you? What are you doing here?" And I said, "Well, I'm on the cardiac arrest team tonight." It's a huge hospital, hundreds and hundreds of beds, probably over 1,000 beds. And he said, "Well, why don't you come around the top and see what we're doing?" And so I said, "Is that okay?" And he asked the surgeon, the main surgeon, "Hey, is it okay if my friend Steve comes and has a look?" And so they made room for me, and I looked over the top, and the patient's chest was open, and the heart was beating, and I'd never seen anything like it, and I thought that is what I want to do. So it was actually a very defined moment for me. I wasn't directionless at that time, but it did give me a very, very clear direction. Okay, that's what I want to spend my life doing. And so shortly after that, I focused very much on and almost solely after that on cardiac surgery.
And pediatrics, when did that come into play?
Yeah, so that's another little story actually, but I was in England at the time. As I mentioned, you would do a 6-year training program, and at the end of that, you were invited for what they called an exit interview at the somewhat famous Royal College of Surgeons in London. And so I was on the train from the centre that I was training in, which was in Southampton. I was travelling by train to London, and I'd been asked to review a manuscript for one of our well-known journals. And for some reason, I'd been asked to review this article, and it was on ECMO, which is a pediatric topic on the whole. I didn't really understand what I was reading. And I understood some of it, but it seemed somewhat ironical. I was going for my exit interview and I was being asked to review something which I didn't really understand. And at that time, I think people had felt that I would perhaps specialize in valves or mitral valves or aortic surgery or some special area within adult cardiac surgery. But again, at that moment, I decided I wanted to be a pediatric cardiac surgeon. And so I went into this exit interview and sat down, and I remember it very, very clearly. And one of the surgeons said, "Oh, so Steve, you've done these things, you've done all the right things. We're very proud of you. We're very happy with your training. What do you want to do? Where do you want to specialize? Where do you want to work?" And I said, well, actually, I've decided I want to become a pediatric cardiac surgeon. And they couldn't believe it. They were very happy. I was happy. They were happy. And I mean, the rest kind of is history. And I did another 2 years training in pediatric cardiac surgery after that moment. And don't regret it at all. I don't regret the extra time. I don't regret the extra challenges. I love the extra challenges. And I've been just incredibly fulfilled as a result of that decision.
So you spent a numerous amount of years, obviously in England, practicing, doing your training. What brought you specifically to Corpus Christi?
So there's a little bit of an interval between the time of finishing my training and coming to the States. And when I finished my pediatric cardiac surgery training, I worked in England for 5 years. And during that time, an old colleague in the States asked me whether I would be interested in joining him in Portland, Oregon. And honestly, initially I really wasn't very interested, but asked a few more questions, went and visited. It was perfect time for me from my family's perspective, and we went and thought, okay, let's do it. And so moved to Oregon at the end of 2007. I was there for about 7 or 8 years, and then moved to Tampa in Florida to reignite or restart a cardiac surgery program there, again in pediatrics in Tampa in Florida, pediatric cardiac surgery. And I had a 5-year contract at that point, and wasn't sure it's kind of a destination place for me, because I'd always wanted to, in a way, be instrumental in the shaping of a program and an area. And I had looked at a number of opportunities around the country, and in fact around the world at that time, and didn't know anything about Corpus Christi, but I was very intrigued when I had the first conversation and a number of conversations, and then 3 or 4 in-person visits before coming here. And there are a few things that attracted me to being here, and that those same things keep me here. I was very impressed with the way that the hospital as a whole, the hospital administration, wanted to align with a vision to create a world-class pediatric heart center. A lot of people, a lot of places that I've worked or places that I've interviewed at or visited, they all say that. Everybody would like that. But are they actually going to do that? Are they prepared to do that? And I felt that the Driscoll Hospital Administration was prepared to do that. That was very refreshing, and there was some evidence that they'd already started to do some of the things that are incredibly important to build a world-class heart center. So that was one reason. I felt that collectively, myself, the hospital in general, we were on the same page. I think the other thing that I felt was very attractive was there's such a need in this area. This has been for years what some people would call a medical desert. It's a highly underserved area, and I was never comfortable with the sort of inequality in care that patients were having, and felt, I think that I can go there and actually do something, actually help some of these families, help some of these children in a way that perhaps I wouldn't in a big city, because other people are doing that, and other people could do that. And I think the third thing that I found very attractive, and still do, is that really I didn't feel there was an end goal. There are goals, but there wasn't, okay, you can do 200 operations here, or you can do 300 operations. we've hugely increased the volume of cardiac surgeries in the past 5 or 6 years since I've been here, which is wonderful. But we're not a destination. We have a strategic plan over the next few years to double what we did last year. But again, that's not a destination. It's part of a journey. So all those three things together made the opportunity here very attractive.
Sure. I want to get back to the growth and the volume here in a minute, where we'll talk about that because it is impressive work that you all have done in a short amount of time. But I want to start first. You joined us in 2019, and almost immediately COVID happens. What were the setbacks, the challenges that your team faced, if any, and how did you overcome those?
Yes, and you're right. I think at the time there was a lot of uncertainty for all of us in all of our lives, in the whole world. We're all uncertain, and it was difficult to know what was going to happen in the future for all of us. We all remember those early days of COVID, and were we all going to make it? What was going to happen to the world? I mean, it's hard for people that weren't involved, or maybe for younger people who've grown up and are teenagers now, to kind of appreciate some of the anxiety that we all had at that time. I think I had the same anxieties as everybody else. It certainly made recruiting other staff, key staff, difficult. And but at the same time, there were patients who had urgent problems or emergent problems that needed dealing with. And so we got on and we dealt with it with all the understood precautions and benefits of PPE and so on and so forth that we were all using at that time. So it was difficult. I don't think it was more difficult for me or the Heart Center than it was for anybody else.
What really stands out to me, I was here during that time, and I remember very specifically you joining us. You're finally getting able to where you can build this team, and we're all excited. And then COVID happens. But I remember one child in particular, Carolina, who came in and she needed heart surgery. It was urgent. And you did that for her. Your team helped her and her family. And I remember they were both so grateful, her parents. And now she's healthy and well, and just a fabulous testament to your team and the work that you do, but also to Driscoll for making sure that that care didn't stop during that time and that you continued to make those children healthy again.
Yes, thank you for saying that. And I agree. It's been to work in an organization that is able to, from my perspective, this is very honest perspective, support what the patient needs, what the physicians, what the care providers believe is the best thing for the patient, irrespective of other factors. There are many other factors that can come in the way of a patient's care, even if a physician, nurse, another care provider thinks it's the right thing to do. And that doesn't happen in Driscoll Heart Center. We're able to give care to patients when they need it, at the right time, and do the right thing for those patients and their families.
So going back to that conversation about the growth, again, you've been here a relatively short amount of time, but have done significant, amazing things. Before you came here, yes, Driscoll had cardiology. Yes, we had cardiac services, but nothing to the level of where we are at now. Talk us through that growth from when you started to where we are now.
Yes, the growth has been very rapid, and I think there are a number of reasons for that. I think that, again, the alignment between the leaders in the Heart Center, the physician leaders and the administration is absolutely critical. And I'll talk about that in a minute. I think that in any walk of life, in any industry, if you have a good product, whatever that is, people will want it. And I think that what we've been able to do by focusing on quality, by focusing on what is best for the patient, by learning from mistakes, by taking opportunities to improve, every day we have got better, literally every day in some way. And it would be very definable, at least in weekly intervals in the past 5 or 6 years. How did you improve this week? What happened this month. I'm confident we could actually define that and write it down. And we have been able to create a culture that allows people to think about what is better. We don't have a culture that says this is how we do it because we've always done it that way. It's a very different emphasis when you have a culture that is, okay, what happened here? We could have done something a bit better then, and why did this happen? Is there something we can do differently? Is there something I can do differently? Is there something you can do differently? A team, a sub-team, or a group of people working in the Heart Center, should we change our process? Should we change the way that we do things? And that that approach, that culture results in an ongoing improvement. And I like to talk about a pursuit of perfection. And why I like that is because perfection is impossible. We know what is perfection. It's unattainable. We use the word sometimes, but rarely as something actually perfect. And what that does within the culture of an organization and what it does within the Heart Center is creates an attitude where you're always striving to do better. And it removes any kind of arrogance or feeling of superiority by saying we've got this down, we've arrived, we're the best. Okay, look at us, we're the best. We don't have that approach. We have an approach that, okay, this is good or this is not so good. How can we get better? And that translates into better outcomes. And by having better outcomes, people know, families know, the people who refer to the Heart Center know, the cardiologist, our own cardiologist, private cardiologist, neonatologist, all the referring physicians who refer patients to come to Driscoll Heart Center. They see our outcomes. They think, yeah, that's where I want my patient to go because these guys have fantastic outcomes. It's also the nearest place. I think that that's hugely important to our growth. The other thing is you can't grow if you don't have room to grow. Okay, you need a bigger space. And as I was alluding to earlier, the hospital has provided us that bigger space. We had last year opened a $100 million expansion, 50,000 square feet of dedicated cardiac space on the 3rd and 4th floor of the pavilion, with a dedicated 35-bed cardiac intensive care unit. When I came here, we didn't have a cardiac intensive care unit. We had 16 beds, PICU, and cardiac. So cardiac and non-cardiac patients were cared for in the same area. And we now have our own dedicated 35-bed cardiac intensive care unit. We have 2 new operating rooms. We have 2 new cath labs, including a hybrid cath lab where the surgeons and the interventional cardiologists can work together. So we couldn't have done what we've been able to do with the volume expansion without the physical space. Now, sometimes we are still bursting at the seams with our physical space, and as we continue to expand, we're going to need more space, and we're having discussions along those lines so to allow us to continue to expand. But I think providing a quality product, having physical space to put your patients, they've been the 2 key things.
Absolutely. You talked a little bit about the care close to home and especially that quality care. What do you say to the families out there in our communities or in our region who feel like maybe they don't know Driscoll's Heart Center? Maybe they feel like they need to go elsewhere to find that care without realizing they can get that here. What do you say to them?
What I would say is that the priority that we have above everything is delivering the best care for your child. The second priority is delivering the best experience and care for the whole family. And many of our patients come from many miles away, some from 10 hours drive away, patients from El Paso, 2-hour, 3-hour flight, 10-hour drive. But many of our patients come from the Rio Grande Valley. It's 2.5, 3-hour drive. Many need to stay for months because they need to be very near a cardiac cardiac surgical center for a period of time. And we do whatever we can to create, a home away from home. And we have a lot of ways of doing that. We have ways of helping the families find places to stay. Many of those are able to stay on campus. We have a wonderful collaboration with Ronald McDonald House. We have our own family rooms on campus, and have a wonderful team of social workers and other people who really put everything together for the family. I think in a different way and a more thoughtful, empathetic, and caring way than honestly anywhere else that I've seen, anywhere else that I've worked.
I know you said you don't like to necessarily talk about perfection per se or hold yourself to this other standard, but as far as the outcomes go, again, y'all are doing amazing work. Can you talk a little bit about the outcomes and how they stack up to other heart programs?
Yes, I can. So almost all centers in the country, and there are over 100 that do cardiac surgery, submit their data, submit the information about the patients, their diagnosis, their operation, various other details to an organization called the Society of Thoracic Surgeons. That's the largest professional cardiothoracic organization in the world. So the Society of Thoracic Surgeons, or the STS. And we submit a Driscoll to the STS, in fact, to the STS Congenital Heart Surgery Database. And the STS analyze our results and look at the patients that we operate on and tell us about our mortality. They tell us about our length of stay. And they break the patients down into 5 different groups. 5 different groups of risk, which we call the STAT categories. 1, 2, 3, 4, 5. So risk 1 is a low-risk patient. That's a patient that has a very high chance of surviving. And going down through to 2, 3, 4 to 5, the risk 5 patients, they're the most high-risk patients. They are the patients that are least likely to die out of the group of patients undergoing cardiac surgery. And so we can look at our results and we can compare those with everybody else's in the country. In fact, anybody can do this. This is free information. It's published on the STS website, and you can look and see the number of patients. You can see the number in each risk group that you've undertaken, and you can see your mortality overall, and you can see your mortality for the different risk groups. For the past 6 years, we have our outcomes overall, so for all patients having cardiac surgery, are some of the best in the country. We have been consistently in the group of 15 to 20 patients. I think on this most recent publication, there were 14 hospitals in the country whose outcomes overall were significantly better than everybody else's, and we were one of those. We were one of those 14. For the most high-risk cases, so what we call the risk 5, the stat 5 cases, there are only 5 hospitals in the United States who, according to the STS, have outcomes that are statistically significantly better than the rest of the country. And I'm very happy to tell you, although it's freely available, we are one of those 5 hospitals. And in fact, of those 5, we have the lowest observed and adjusted mortality of any heart center in the country at the moment.
Wow, that's fantastic news. Congratulations to you and your team, because truly it's a testament to the great work you all are doing. What kind of work, or, I don't really know how to put this, but that kind of achievement takes a certain level of dedication and commitment from your team. What does that look like for your team behind the scenes?
Yeah, behind the scenes, it does take a lot of work, and you see these numbers, and we're proud of them. We're happy. It's very helpful to us as we grow to have if you like, as I was talking about earlier, a quality product to tell people about. But it does hide a lot of the things that go on. I think any patient that has cardiac surgery, there's a lot more to that whole process than perhaps meets the eye. And it starts at the point of referral, when a cardiologist or a neonatologist refers a patient to us for cardiac surgery. We collectively, as a group, look at all the information on that particular patient. It's not somebody calls me and says, "Hey, Steve, will you do this operation, or what do you think of this? That's not how we do things. We do things collectively. We do things as a team because we get better results by doing things together than by doing things individually. And so that the cardiac surgery starts at the point of referral and the point of a meeting to discuss that patient. We meet every Friday morning. We met this morning, Friday. We met to talk for 2 hours about the patients that were having surgery next week and some that were inpatients that had just arrived as more urgent cases into the hospital. We talk about the patients. We're very thoughtful. We get the right investigations so we can make the correct diagnosis and then thoughtfully decide about what operation is going to be done. Then the operation is undertaken. And it's not just me in a room on my own doing heart surgery. There are many people in the room. We have highly trained and skilled cardiac care providers that are helping with the surgery. So we have cardiac anesthesia. We have, when we do open heart surgery, we have to connect the patient, we have to connect the baby to a machine. We call that a cardiopulmonary bypass machine. It's a machine that is pumping blood around the patient's body and putting oxygen into that blood. And that machine has to be run by a very skilled person called a perfusionist. So we have a team of perfusionists who run that machine for us. We have specialized nurses and scrub techs in the operating room. So, you know, there's always 6 or 7, sometimes there's 10 or 12 people in the room, in addition to me doing the surgery, focusing on the patient. So there's a lot that goes into the operation itself. And then after the surgery, it's not okay, we've done the surgery and now the patient's going to recover. Recovery is a very active process. There's a lot of things that can happen in recovery that we need to control, we need to look after, we need to anticipate, we need to make sure they are done as thoughtfully and as well as possible. We have I don't even know how many cardiac intensivists now. We have 10, 12, and we're recruiting more. We have a lot, and they're wonderful, and they look after the patients after I've done my bit. I see the patients many days and involved in ward rounds, but from a minute to minute, hour to hour basis is the team on the cardiac intensive care unit. We have over 100 nurses who specialize in the cardiac intensive care unit. We have respiratory therapists. We have the cardiac intensivist. There's a lot of people. And then think, okay, well, that's fine. The patient can go home. Yes, they can. And that's wonderful. That's what we want the patient to do. But then they have to be looked after as an outpatient forever. Okay, and that's pediatric cardiology. And so it's not just recovering from the surgery. We frequently talk about a cure for cardiac surgery. And I think that is appropriate. Many patients, we can say we've cured. But really, if you're born with congenital heart disease, if you're born with a heart condition, really you carry it your whole life, and it's very important for all of us and for patients and families to understand that this is something that could affect you, your whole life. And so, ongoing care, ongoing follow-up is paramount and is essential to achieving great results.
So we talk about the growth with the team, with the volume of patients coming from El Paso, really some amazing growth happening, not just with the Heart Center, but across the system-wide. What are you most excited about for the future?
I'm excited about our ongoing growth. And growth is a benefit to the Heart Center, to, in fact, other patients, and to the whole organization. I'll explain why. The more patients we look after, the better we as a team, the better we as individuals become at looking after a particular condition. So that's incredibly important. We've spoken about that already. I think because of the fortunate, for me, I suppose, or for us as a Heart Center, the way that we're reimbursed, a strong Heart Center allows us indirectly through the hospital to support other areas within pediatrics that perhaps are not as well reimbursed. So a strong Heart Center, growing the Heart Center, inevitably helps other areas grow. So it doesn't just result, I think, in perhaps financial support. It also results in more procedures, more more patients for other pediatric subspecialties. And so it's incredibly important for the whole organization that the heart center grows. It's not the only way that other parts of the hospital grow, but it really does, in some ways, feed many other areas of the hospital. So I'm very excited about that. I think as we grow, we're going to be able to provide more comprehensive services, perhaps some more specialized things that we only see occasionally, including perhaps the ability to open cardiac transplantation. It'd be wonderful to be able to do pediatric heart transplantation here in Corpus Christi. Is that possible? It is possible, and we'd love to do that. We were talking earlier about when you have a condition, a heart condition that you're born with, you carry it your whole life. That doesn't just mean your whole life as a child. It means as an adult as well. And in fact, in the United States now, there are more adults with congenital heart disease than children. And very rarely, for a variety of reasons, at Corpus Christi, at Driscoll Children's Hospital, do we operate on adults. I think that's going to change. I think our heart center should be operating and will be operating on more adult patients over the next few months and years. It's the right thing to do. We understand the diagnosis, we understand the condition, and many of us have a lot of familiarity in looking after patients with congenital heart disease who are adults. So there's a lot of things that I'm excited about, as you might be able to tell, and we'll see how it goes.
How does philanthropy and community support play a role in this? We talked a little bit about the expansion of the Heart Center in our pavilion and the new cardiac ICU. How do you see philanthropy playing a role in this?
I think philanthropy is vital, and for many reasons. The obvious reason that, okay, somebody is very kindly giving some money to help the hospital or help the heart center. Okay, that allows us to have perhaps some of the facilities, some of the equipment that we simply would not be able to have otherwise. I think creation of an endowed chair is attractive to a physician or to other people. I think that the fact that people in the community, individuals, organizations want to give to Driscoll reflects very well on the organization and allows a closer tie with the community at large. And so I think that overall philanthropy is, I encourage it, I support it, it's wonderful. We're very grateful to it, and it allows us to really make a difference in what we do.
As we wrap up, I want to hear from you. This is a very demanding role that you have here. I don't know exactly what your hours are. I'm sure they're all over the place in your schedule, but what keeps you motivated on these hard days?
Sometimes it is difficult. I think when you see the end result of all your labors and you see a patient going home, we have patients, sometimes they leave the intensive care unit, they sing as they leave. It's wonderful. I have a couple of videos of a child singing as he leaves after a really difficult time in hospital. When you see children united with their families, when you see them later, when you bump into them. I was at the art museum recently and was just leaving, and I saw a family and they stopped me, and I hardly recognized the child. I recognized the parents immediately, and of course we had photographs and so on and together, and that kind of thing is so fulfilling. It is difficult. What I do is difficult, and sometimes I do ask myself why I'm doing it and how long do I want to do this for, and but those moments are relatively fleeting, and the overall impression is one of tremendous fulfillment to be able to help these children and their families.
Yeah, well, we're very fortunate to have you here at Driscoll. Very grateful for the work that you do. Kind of on a lighter note, before we end this, what is something you like to do outside of work in your little free time that I imagine you have?
I like a lot of things. Many of the things I don't quite have as much time for as I used to. And somebody said to me, they were talking about their retirement. Okay, somebody who's older than me, and I said, "Oh, what are you going to do?" And he said, "Oh, he wasn't too sure." He said, "What would you do?" I said, I have so many things that I would like to do that I'm not sure how I would fit them all in at the time. I love spending time with my kids. I enjoy various outdoor activities. I play golf from time to time. I like the water. I love fishing. I like kiteboarding. I like going to the mountains and the snow. I like keeping in shape. I like traveling. I love life. I love loads of things. So I like lots of things, lots of people.
I have to ask, as a fellow angler, how does the fishing in Corpus Christi compare to the fishing in your hometown?
It's very different. It's a lot warmer here, and it's you wouldn't really go out in shorts where I grew from. Maybe in the summer, and I have to say it's a bit more productive here. So I like it.
You enjoy the fishing. Good. Well, I'm glad you find time outside of work, because
Thank you.
the things that you do here with these patients, the care you provide, you and your team, again, truly is remarkable. And so we're grateful to have you here at Driscoll. I appreciate you taking the time to be on the podcast, and we look forward to hearing all of the exciting things that are coming next with Driscoll's Heart Center.
Thank you, Whitney.
Thank you. Thanks so much for joining us on today's episode of Hospitalk. Please be sure to follow us on social media, share our episode from YouTube, and if you'd like to learn more about the Heart Center, visit us online at driscollchildrens.org.